Today I'm going to discuss the difference between SI joint or sacroiliac joint pain and hip joint pain. So the first thing I wanted to review is a little bit of the anatomy. So here we have the lower part of your lumbar spine and we have your hip joint here. So this is the top of the leg bone, the femur, and it's a ball and socket joint, and this ball goes right into the socket right here. Your sacroiliac joint is kind of back here. It's where your sacrum, which is your sit bone, meets this ilium here, which is part of your hip bone. So it's kind of deep down in there. So there's two different surfaces and there are two different kinds of joints. So the surface down here where the femur enters the socket is the hip joint, and there's a lot of mobility in this joint, and this socket glides on a smooth piece of cartilage in here called the labrum. So that's how we have all this movement. You can go forward, backwards, rotate in, rotate out. So the difference there is then the sacroiliac joint here has two little small areas of cartilage. One is hyaline, and that's the smooth cartilage. And then the other part is a fibrous cartilage, and that's not so smooth. That actually provides shock absorption to this joint, and therefore, because part of it is smooth and part of it is not, the movement availability in this joint is small, and that's okay. We want it to be small. With this hip joint here, pain can be either in the front of the thigh area. It can also be deep within the hip joint itself. So sometimes you might want to grab your hip because you feel pain, and that's usually when there's a deep ache inside the joint. And then also can refer pain to the front of the thigh with the groin. Those are pretty much the biggest referral patterns for the hip joint. The sacroiliac joint, so the joint back here, can kind of mimic similar referral patterns. So it can send pain to front of the thigh, it can also send to the buttock, and it can also cause a little bit of pain in the back. So people have a hard time differentiating between, well, is it coming from my hip or is it coming from my sacroiliac joint? They both refer pain to the front of the leg. That can kind of cause a misunderstanding as so far as where the pain's actually coming from. What does physical therapy do? So physical therapy, because we are experts in how the body moves and we know the anatomy of the body, we can also perform special tests during an evaluation with the patient to determine, where is that pain actually coming from. And so based on those findings, we will be able to give the patient a better idea about the treatment plan and what things we need to do to address those things. Lots of times with just physical therapy alone, we can significantly alleviate or reduce the pain that you're having and prevent any other forms of intervention from occurring in the future. We can educate you on the proper exercises and proper stretching techniques that you would need to do to handle this on your own at home. We are able to determine whether we think physical therapy alone will also help. So sometimes further intervention is needed, and we will be able to tell you during your physical therapy plan of care, during all that treatment time, whether or not you would need to seek alternative forms of treatment. But most of the time, if you go to an orthopedist, they'll send you to physical therapy anyway. If you don't handle something like this, it can definitely become more serious, especially with the hip itself, because that is one of our biggest movement joints in our body. So if you do not address the pain and increase the strength around the joint, then the friction between the femur bone and your hip bone will continue, and you will become bone on bone, and then at that point there's no other intervention besides usually a total hip replacement. Usually replacements are done as a last resort, so that's why physical therapy is very beneficial, because we can strengthen the muscles around the joint, give the joint more support, which will alleviate the pain and improve your function, and kind of push off that possibility of a hip replacement further and further away until it's absolutely necessary. Also, if not handled, you're going to lose function. So you're not going to be able to do the things you enjoy with family members. Traveling, prolonged sitting positions are usually problematic with a sacroiliac joint pain. Sitting in that position causes that friction between that piece of cartilage that's there, and it becomes very uncomfortable over time. So that will limit your travel ability. So like I said, the need for less conservative treatment, such as injections and possibly surgery, will occur if you do not handle this right away. If you would be interested in learning more about your pain, please click on the link below and set up an evaluation with us.